ABCs in pregnancy, part 2, we're going with D, so diet. Diet is very important. You want to have meals that are high in protein, low in carb. You want to avoid the sugary sodas, fast foods, things like that, and try to have a well-balanced diet. Domestic abuse is very important, so we'd like to know if you feel safe at home or with the people you are surrounded by, if you have a good support system. Discomforts during pregnancy are very common. It's not to cause any worry because there's going to be lots of changes about yourself. They're just new to you, so they are normal. Drink extra fluids. Very important that you should have at least half your body weight in ounces. Some people say 8 to 10 water bottles. So, for example, if you weigh 200 pounds, then 100 ounces of fluids is what you should intake. Okay. E for eat healthy. This is where we're talking about that balanced diet. Should be a colorful rainbow, red, greens, yellows in your choices of foods that you have. E is exercise as well. Try to have 30 minutes of exercise throughout the day. Even little things like stretching like this can count. Reaching side to side, just elongating your body, making more room for baby to grow, and kind of keeping those joints and ligaments nice and loose. Emotions. This is one I tell everybody when I see them. It is like an emotional roller coaster, and I look at the partner and I say, please bear with us as we try to get through this pregnancy, because there's all types of emotions that you'll feel, and you'll have ups and then downs and then back ups again. It's hard to explain, but the emotions can be all over the place. F is for fetal screening. This is where you have ultrasounds and labs throughout your prenatal care that are normal, routine labs that all guidelines and recommendations follow for pregnancy. Want to make sure you have your folic acid in your prenatal. If you have a higher risk factor, we will have you take an additional folic acid, but we will let you know this. Food choices are very important on what's safe and not safe during pregnancy, what's good and what should be avoided as well. We'll go over that. The father of the baby, if there is one, should be involved as much as possible, because it's a big transition for both of you and they need to understand. So if there's not a father, if there's a support person or a caregiver or somebody who's there with you to go through this together in a joint setting. Talk about financial needs of providing for a baby and also supporting a family. Follow for part 3.